All right, we'll get started. Good morning, everyone. I'm Amy Dolinky, and today we'll be going over the opioid settlements, specifically the funds that are directed to counties, with a bit of the overview related to how the state funds are connected and the broader scope of what the settlement funds mean and how they can be used. So I'll jump right in. Feel free to put any questions. I think you have the chat or the Q&A feature on your end. Both should work out just fine. So overall, in the state of Michigan, we're expecting about $1.6 billion to come into the state. So approximately half of those funds will go to the state government and approximately half will go to local governments. And so cities, townships, and counties may be receiving funds. So far, we do have 100% county sign-on for the majority of the settlements. So you'll see some of the settlement names listed here. And if you go to the website we'll be talking about later, you can see from a dashboard, there's more information related to each of these specific settlements and their requirements. So this dashboard here that's on the Michigan Association of Counties Opioid Settlement Resource Center website is a bit of a brief overview for counties to understand how much money they can be expecting. So in the upper right-hand corner, there's a drop-down where folks can choose the county that they're from and see the estimated totals for each of those settlements. In the bottom right, we'll see maximum number of payments. So while we typically work on a calendar year or a fiscal year, the settlements don't quite work that way. So folks may not be receiving funds every year, but it's just a bit easier to say we can anticipate that something like the distributor settlement is over an 18-year period, although many of those payments can come in at the same time. So we'll get into that a little bit today as well. And then the bottom left, we see the split for each settlement. So how much money is going to state government and how much money is going to local governments. Across the top of the dashboard, you'll see other tabs that you can click on the website. Each of those point to different information and data that we've collected through our annual survey. It's a voluntary survey that goes out in the spring and allows counties to share with MAC what's going on in terms of their planning, management, spending, just to paint a broader picture of the settlements for really understanding where those dollars are going, for folks to learn from each other and to have a space to really paint this picture that we don't get in another way since Michigan does not have local reporting requirements. So when we talk about the maximum number of payments, it's important that we understand how these companies are paying. So many of them are paying with their profits. So they will continue to provide services, whether that's pharmacy services or manufacturing. And with those profits, they are typically paying these settlements. So it can take some time. Some pay out in a one-time payment and some pay out over many years. They can front load their payments and they can also skip payments. So understanding how much is coming in on an annual basis or determining an average amount that a county is comfortable spending to really ensure that funds are still available and the planning for the programs they're funding can be sustainable is really a key element. So not financially an easy or simple process, since those payments can differ as well. So counties may receive $50,000 one year, they may receive $20,000 the next, and they won't necessarily be sharing that in advance. Now, the Attorney General's office has created a great tool, the Opioid Settlement Payment Estimator, which is linked here on this page, and you will receive these slides after the presentation. And on that website, we can see the estimated payments per year per settlement. So a bit more detail and a really great resource that's updated on a regular basis. So folks are really encouraged to go to the original link as opposed to downloading the file, but can really help for those financial planning aspects. Now, when we talk about spending requirements, most of the settlements have the same spending requirements. They all have a little bit of difference when it comes to certain aspects, but most are using the document called Exhibit E, which is legally defined as a non-exhaustive list for opioid remediation or opioid abatement. Now, Exhibit E is about 15 pages and really highlights some of the most evidence-based practices that exist for purposes of opioid remediation. And it focuses on prevention, harm reduction, treatment, and recovery, and avoiding items that are punitive or coercive. So with the Exhibit E requirements, that's only part of the spending requirements. We also have how funds are used. So 85% of funds have to be used for opioid remediation, or really in alignment with Exhibit E. 15% of those funds are unrestricted. And with that, that's the place where we see the reporting requirements. So we'll get into that in a bit. But of that 85% that has to be used for opioid remediation, 70% has to be used for future opioid remediation. This does not mean prevention. It really means activities that have not yet taken place. And so when we talk about the county has already spent X number of dollars on opioid remediation on something that aligns with Exhibit E, there is that 15% buffer to allow for reimbursement for the county. So this is the legal definition of opioid remediation. So when spending, activities have to align with both Exhibit E and the definition of opioid remediation. And I really want to point you to number 2 here on this list, treat or mitigate opioid use or related disorders, which does allow for a broader scope for these funds. So it doesn't necessarily all have to be used for purposes of opioids. As we know, the drug environment is constantly changing. And over the next 18 or 16 years at this point that we'll have funds to spend, it doesn't necessarily mean those same drug trends will be present. So number 2 here allows for addressing polysubstance use, so folks that are using more than one substance, or co-occurring conditions, specifically both mental health and substance use together. So folks that have multiple diagnoses. So this really opens the door to provide more comprehensive support and support that is more proactive instead of reactive to the specific opioid crisis that we're discussing. When it comes to reporting, I did mention the voluntary survey that MAC offers on an annual basis. But in terms of reporting requirements within the settlement agreements or the legal documents themselves, counties are required to report twice a year to a company called Brown Greer. They're identified as the National Settlement Administrator. And with that, in order to get those funds into the county, most folks are using an ACH through this payment portal. Either way, the payment portal has to be completed, and approximately 3 people in each local government have access to that portal. So the reporting takes place in the same portal that folks are requesting the funds in or signed up for to receive funds. So when you're reporting, you're only reporting on activities that do not align with Exhibit E. So that 15% that are unrestricted. Some counties are putting 100% of their settlement funds towards opioid remediation, while others are using that 15% for other activities. So if someone were to do an infrastructure project unrelated to substance use, or a roads project or a bridges project, that would be something that would be reported to Brown Greer on that biannual basis. But right now in Michigan, there are no additional reporting requirements for local governments. So for the voluntary reporting through MAC, it does not ask about specifics, or it gives it kind of an optional space for counties to share about specifics, but really focuses on which areas or buckets are counties spending in, the prevention, harm reduction, treatment, recovery spaces, and who was involved in the planning process. Is there any public facing information that MAC can promote or support, like websites or reports that have been developed? And and what type of planning process is used. So a real focus on what does the entire process look like, not just where are those end dollars going. What is challenging about these funds and a benefit to local governments is that each local government determines their own allowability of their expenditures. So corporation counsel or specific attorneys that have been brought in for settlement purposes are the only ones that can determine, yes, this is allowable and in alignment with the definition of opioid remediation, as well as Exhibit E. So MAC has been able to provide analysis for funding proposals, determining if things are evidence-based or promising practices, but that's not necessarily a determination that anyone outside of the county can make in terms of what is allowable. So that means that within a city that is seated within the city and the county may have difference in what is allowable. So it creates a bit of a challenge even within the county and then from county to county or within the regions. So there is nothing else right now that is available. The Attorney General's office is responsible for enforcement. So they would be the one that would potentially do an investigation if funds were determined to be misspent. And so having that legal backing and support for why this specific expenditure was allowable is really critical when moving forward. So there are a few other settlements as well. So the Mallinckrodt settlement, some folks have received funds for. There's only a few counties that are receiving funds. They're the highest populated counties in the state and the state government. So they have received some payments from Mallinckrodt, but we don't know if they're going to continue to receive those payments or if there will be issues as they filed for a second bankruptcy. And that settlement was structured differently. So we have the regular settlements, the distributors, J&J, all the ones we've kind of talked about before, and then we have the bankruptcy plan settlements, which have a different structure. So the Mallinckrodt settlement, we're kind of still uncertain of. And then in the future, we are expecting Purdue Pharma to have another bankruptcy plan settlement as well, although that process has been very long, and so we don't know what that will look like or mean for Michigan or really the rest of the country. With Endo, that payment just came into the state of Michigan, and local governments will not be receiving funds from that settlement. And then there are a few other settlements that go directly to the state. The state, in some cases, has to move some of those funds back out into the communities. In other cases, the state is not required to do so. But it's really important that Corporation Counsel is involved in all of the conversations related to settlements, as there are so many different requirements for each settlement, and folks will want to make sure that they're identifying which pot of money the specific expenditures are linked to for reporting purposes. When talking about the allowable use of funds, we'll kind of jump into Exhibit E here. And Exhibit E has a few different sections. The first of those is core strategies. So these are the strategies that are the most evidence-based. So we have more proof of their success than some other programs that are out there. And so many of these are focused on special populations. So those individuals that are in carceral settings, pregnant and parenting folks, as well as folks that are currently using drugs. So you'll see that there's a real kind of direction towards those most profoundly impacted by the overdose crisis. Then Exhibit E has an approved uses section, and that's broken down into a few smaller pieces. So the treatment section has things that we would expect. So treatment for opioid use disorder, treatment for co-occurring conditions would be categorized in this area as well. And then again, you'll see special populations throughout. And in this section, we do see some recovery items talked about, and we'll see kind of some some of the same when we talk about prevention. So in the prevention section, there's a few different components. A focus on opioids and prescribing absolutely is the first here. And in the larger document, these are really just the headings. There's additional information under each of these to provide additional understanding, support, or specifications. And then when we talk about other strategies, so let me just jump back. So in treatment, we see treatment and recovery kind of put together. And then in prevention, we see prevention and harm reduction put together. And they really can be distinct areas. So in the other strategies category, we see support for first responders. And I really want to point out that there's really only two ways to support first responders with these funds. One is for training on how to respond to overdose. And the second is how to support first responders for responding to overdose. So really focused on that secondary trauma that's associated with responding to overdose. We also see planning and coordination as an aspect of Exhibit E, and training and research. Now, what we don't see in these headings, but what is allowable also according to Exhibit E, would be specific infrastructure projects related to substance use disorder, related to overdose response. So that may be a vehicle for a program that is transporting patients or clients. It may be updating the HVAC system for a treatment facility that then would be able to offer more beds or more support or services. Of course, there's a large component of consideration with all of these in Michigan around what the substance use or behavioral health workforce looks like as well. So when we get into the spending principles, these are not a part of kind of the legal pieces that we've talked about so far. The spending principles were developed by experts from all around the country, brought together by Johns Hopkins Bloomberg School of Public Health. And the principles were really created to help governments, both state and local, focus on where they could prioritize their process, where they could prioritize their spending to make sure that we weren't duplicating the experience of the tobacco settlements. And so there's a whole website developed to talk about these principles. The link is provided on this page, but just wanted to walk through the general principles. So focusing on spending money to save lives. So again, that focus on who's most profoundly impacted, how do we reduce these deaths? As many of those folks we can help later on, even if they may not be ready for the services that that we could potentially want them to go into. This is also really important to understand how much money do we want to put forth in year 1, in year 2, in year 3? How many years do we want to have funding available? So some folks are saying we want 18 years of funding. We think that will create more sustainability of what we're going to fund. And then, of course, this dedicated fund for these dollars, making sure that these funds are separate. Treasury, the Michigan Treasury has a specific fund number that is already dedicated to opioid settlement funds. That's typically set up in most counties at this point already in the process. Then when we get to principle 2, using evidence to guide spending, we know that what is evidence-based in Detroit may not be evidence-based in the UP. We know that there are differences in every single community and their needs, and it is important to use data-driven solutions to addressing this crisis. There are a lot of programs, activities, promising practices throughout the country that folks can pull from, but also a lot of incredible work already happening within the communities. And so there's that local data is a huge component of using that evidence to determine where to guide that spending. And I think with this piece, this is really where MAC has been able to support as well in making sure that folks have information. And so they've created the Opioid Settlement Resource Library. another tool to really help in this process. But these principles really being the foundation of a lot of counties' planning and spending efforts. Principle 3, investing in youth prevention. Upstream work, we know, has a great return on investment and really helps those future generations. The key with youth prevention is ensuring that the programs are evidence-based. There are many things that sound great in supporting youth, but often we do not see any change in behavior from youth without those evidence-based programs. So that's a really key component there. Principle 4, focusing on racial equity. What we know and what the data in Michigan really highlights is that there are profound differences between races and overdose rates, access to care, many things. And so with Principle 4, it's just important to understand who's in your community, how are they impacted, are they at the table for planning efforts, and how do we make sure that all of the community members' voices are heard and that the spending really addresses how we can support the entire community. And then Principle 5, a fair and transparent process. MAC released some transparency guidance in August, and the national guidance through Johns Hopkins is an adaptation of MAC's guidance. And so with that, there are many tools and templates that we'll talk about that MAC has created to help with developing the transparency aspects of this work, which can really start from day one in those planning efforts, that you don't have to wait until the spending is complete to identify what transparency looks like. And so when this is taking place, many communities have decided to move forward with technical assistance from an external provider as well. So the Michigan Department of Health and Human Services has contracted with 3 universities to create the Technical Assistance Collaborative. And one of those universities is MSU, and they are providing community assessment support. So through using local data, as well as surveys and focus groups and interviews in many counties, they're able to pull together a report that really points to where some of those specific county needs are. And then many counties have chosen to make those reports public and really help the rest of the community see what those needs may be. So the Opioid Settlement Resource Library that I mentioned, it's a pretty extensive combination of items. So there are evidence-based practice sections. You can really find a lot of different tools and toolkits throughout the website. There are legal resources, equity resources, and then additional opportunities for funding. So we know that this isn't a lot of money. It sounds like a lot of money. It's fantastic that this money is coming in, but at the end of the day, this money will end at some point, and it really is just one piece of what's available within communities. And so trying to find ways to braid or leverage other funding sources we know is key. And so there is a list there of different websites with different local and national funding spaces, and MAC will continue to send out new funding opportunities as well. Accessing the state settlement funds is not as easy for county governments as it is for community-based providers, nonprofits, behavioral health providers. They're typically eligible more often for many of the funding opportunities through the state with state settlement funds than the counties are. But on occasion, there are opportunities where counties can apply to receive those extra state funds as well. So MAC, in partnership with Vital Strategies, developed a toolkit, a guide for local spending. This is really a process document focused on, if I was starting planning from day one with settlements, where would I start? What direction would I go? So this toolkit's available on MAC's website and really is a great starting place. Many counties across the state have already started using this and have used this as a bit of a roadmap for their direction moving forward, because it does allow for all of those local pieces that are specific to be in place. So wanted to create a document that was more universal and allowed for everyone to understand where their community fits in. So with that, there were 4 main sections of the toolkit, the first being stakeholder engagement. And many counties were able to develop a steering committee to be able to help with the planning efforts for everything from what process would be used for determining where to spend, and then, reviewing requests for proposals if that's the direction folks went, or helping with a needs assessment. So those steering committees are up and running in many places throughout the state. And the next was around data gathering. So there's so much local data that's available. Local health departments have data from their own collection. There's the My Celerity system that's housed with MDHHS. And there's the Substance Use Vulnerability Index and the Data to Action dashboard that MDHHS also house. And there's places for all this data, and many of the providers locally and the prepaid inpatient health plans have strategic plans or other data that may be useful in determining what the current scope of the crisis is within the county and what work is already taking place. So then folks were asked to kind of determine their process moving forward. So this is really a question about capacity. So is there additional need for strategic planning, or is there work already underway? Maybe there was a local coalition that had been working on addressing the overdose crisis for years already. And maybe that work could be tied in or the basis for local spending. And then determining how do we prioritize the strategies that we want to use. So based on that existing data, based on that local data, where are the greatest needs and how do we move forward with spending in those places? And then monitoring and accountability. So this was a real focus on transparency and reporting. So without statewide reporting requirements, is there any information that counties wanted to make sure that they were sharing with their community members on a regular basis, and information that they wanted to make sure people had in terms of who to contact if they had input in this process? So jumping back to that steering committee, it's really comprised of those local stakeholders. So the toolkit outlines a list of recommended stakeholders, and there are so many different folks from so many different areas that we would really hope to see and have their voices as a part of these discussions, especially including those with lived or living experience of substance use. So on MAC's website, throughout this process, there's been, to supplement the toolkit, there have been many templates and tools created, and they're all available in their original format. So Word, Excel, PowerPoint, to be able to be customized at the local level. And so we've seen many of these used, everything from contracts to execute with vendors or grantees, RFP templates, budget templates, annual report templates, as well as specific guidance documents. So steering committee development guidance and transparency guidance. There have been a couple webinars, and those are recorded and posted on the website as well. And then starting in July of 23, oh gosh, a couple years ago, there was the beginning of the Local Government Learning Community, which is a partnership between MAC, MTA, and MML as the one place for all local governments to be able to come together and really learn about each other's experiences, challenges, strengths, and hear from local experts on what's taking place with a specific part of their process. So how did that request for proposals process look in different counties? Are there any considerations that others should be thinking of? Or having folks from MDHHS come and present about where the state is expecting to fund, as we know that folks aren't wanting to duplicate those services as well. So it's closed meeting to local government officials and steering committee members that have been asked to participate by those local government officials. And it's really just a space for continuing to understand what those needs may be and how MAC can better support your settlement efforts as well. So when we look at a statewide kind of view, let me take a step back actually. So before we look at the local statewide perspective, I just want to give a bit of an overview about what's going on really at the state level. So within the state of Michigan, we have primarily two places where state funds are directed. So those funds come from Brown Greer, that national administrator, to either directly to a local government or they go directly to the state government, specifically the legislature or state treasury. Then the legislature is able to appropriate those dollars. We've only seen those funds appropriated to two places so far. The first being the Michigan Department of Health and Human Services, and that's where the majority of funds have been allocated, and then they are doing work internally as well as providing opportunities for folks in the community to receive those funds. The other place that we've seen funds appropriated is to the Attorney General's office, specifically for overseeing the settlements. They're really the legal experts on all of these very complex documents and have provided support and communication with specifically the attorneys representing the local governments in these cases. And that's where we see things like the state subdivision agreement, which is what the locals in the state agree to with each of those settlements. And the piece that is a bit outside of that is the Opioid Commission. And the commission takes place very separate from the executive branch. So on the executive branch, we see there's a task force under MDHHS, the governor's opioids task force. And then on the legislative side, we have the Opioid Advisory Commission. And that's a group of volunteer experts in substance use, whether it's prevention, harm reduction, treatment, or recovery. And that group focuses on making recommendations specifically to the legislature on maybe where funds should be appropriated or policies that may need to be changed. And they put out a report typically every March, February, March. That'll be their annual report. So we can anticipate to see that shortly to see what they are kind of suggesting. And the opioids task force, their meetings are not currently online, but they are open to the public. And the Opioid Advisory Commission, their meetings are available virtually for anyone to attend as well. So when we look at the local governments and what we've seen across the state, the MAC survey was really the basis for the data I'm about to show you here. And with that, the goal was to really understand what does this look like across the state, and that we were able to collect both information for the dashboard as well as analyze the data collected in a report that's linked here at the bottom with some recommendations also. So some of the questions that I thought really stood out through the survey were about community involvement. And we asked folks if they were involving their community specifically in helping to understand what the priorities, needs, and strengths were. So not necessarily what their priorities were or in terms of spending, but where were those needs that we saw most. So 67% of the county said they were involving the community in helping to understand those needs. And what we've seen in kind of narrative responses to this was that many of those counties were doing this through a community assessment process. So surveys, focus groups, listening sessions, interviews, different ways to specifically ask this type of question. We also asked who is at the table for planning purposes. And what we see is kind of two sets of data here. So the first is from the baseline assessment, which was about 2 years ago. And then the second was the first annual survey. The questions were very similar, and that was last spring. So you have those two sets of data. So the first was, who do you expect to be engaged in the process? And then the second was, who is actually engaged in the process? And we see a bit of difference here. So we see that folks were really expecting to engage public safety and the criminal legal system, and those folks were most represented at the table. So that was very accurate. I think schools and universities, we see a large discrepancy in. So folks thought they would involve schools and universities, but not as many counties had done that. And then when we look at individuals with lived experience, we see more engagement than was anticipated. So that's been a really exciting piece to see in this data as well. Then when we look at how folks were engaged, many sent out a specific invitation to individuals or organizations that they knew were involved in the field or a part of that field. So with that, it's always important that we keep in mind who might be missing from our kind of general circles when we're talking about behavioral health. Is there a new grassroots group that has started in the area? Or are there folks that have lived or living experience with substance use that maybe we're missing, or they're not necessarily engaged in one of these organizations already? And then the second way we saw engagement was through targeted outreach to specific communities or populations. So specifically individuals with lived or living experience. And there's a lot of ways that we can do that. One of those webinars mentioned earlier was on how to have meaningful engagement with people with lived and living experience. And there's a key takeaways document on MAC's website as well, as we know that that's not a population that most folks have had the experience of engaging with in past work. And then we asked about who had a plan for spending their funds. So over time, we have seen a real change in who has been able to have a plan for spending, and we're seeing that continual kind of growth of that plan. Now, at this point in the process, I will say the majority of counties have moved their first dollars out the door. And so it's going to come down to, did that county create a 1-year spend plan, a 2-year spend plan, a 3-year spend plan? Is there a way to reassess what's going on an annual basis? What reporting requirements were put in place with those grantees? And I think all of this really leads to additional pieces of work that can be done in this space to really understand how do we move forward in addressing the crisis over the duration of the time frame that funds are coming in. And then we asked if folks were planning on requiring their grantees to report on activities and outcomes. So the majority of counties said, absolutely, we want to make sure that folks are spending money appropriately, because even when those dollars move out of the county doors and into a community-based organization or another provider, the county is still responsible for that reporting biannually to Brown Greer. And so having those reports back from those grantees or vendors is a really key piece in ensuring that the county can stay on track with its reporting requirements. So I think this is probably the question that is asked most about who is spending, where are funds being spent, and specifically on what. So what you'll see are some of the core strategies from Exhibit E. That's what this is kind of broken down by, are just the core strategies. So not all of them. But in 2023, 50% of counties said that they had not spent yet. And there was a lot of media coverage about why folks weren't spending. But what was really important is that those counties were deeply engaged in their planning efforts and making sure that when they got that money out the door, They felt very confident with where it was going, with the work that would be provided and with the reports that would come back, not just for compliance purposes, but really for making that impact on the most profoundly impacted populations. So when we do see where most of the funds went that did go out in 2023, we see that treatment for individuals in the criminal legal system. So this was primarily medication to treat opioid use disorder within the jails. And then we see both expanding prevention programs. Many counties already had existing prevention programs, typically in their K through 12 settings, and they were able to provide additional financial support to either expand those programs or reach different populations. And then access to naloxone or opioid reversal medications was the other top piece. Now, the naloxone itself is free through the state of Michigan. There's a naloxone portal that MDHHS houses that allows for governments, organizations, individuals to request naloxone and get that for free. But what we saw folks spending money on was having different locations to be able to access those medications, or allowing for kits to be made to be handed out. So putting additional resources maybe into a bag with that naloxone for outreach purposes. So it was really around getting the naloxone out, but not on the naloxone specifically. So any questions at this point? I'm gonna stop sharing here. Well, what I'll say is this is, a broad overview with a lot of information. I would absolutely suggest visiting the Michigan Association of Counties Opioid Settlement Resource Center website and being able to reach out with specific questions. So every county is doing this differently. I have not seen the same process used in 2 counties. And while with MAC, I worked with 72 of the 83 counties. So everyone's doing this differently. And I think there's so much of that that's important to understanding local needs, working with local stakeholders, and making sure that there's a process for moving forward that takes into account those local needs and county capacity to do so. So absolutely feel free to dig through that website to reach out with any questions. Mac absolutely knows how to get in touch with me as well. And I think with the state landscape and the local landscape, they're very different as well. And so if there's additional interest in understanding more about the state landscape, I'm happy to have those discussions. And on the MAC website, there are 2 documents. They're FAQ documents, one to help understand the settlements themselves, and one to understand who specifically agencies, individuals are really responsible from the local side and from the state side. So kind of who are the key players in that space. And I will say that the Attorney General's office has their opioids website, and there is an opioid settlement website with the Michigan Department of Health and Human Services as well. Both are great resources to access. All can be found on MAC's websites, links to all of those also. And then I think the only other thing I'll probably leave you with is around enforcement. So I mentioned that the Attorney General's office is responsible for those enforcement activities. But what we don't have in Michigan is a publicized or public information on what enforcement looks like or means. So currently the structure, and this may change, all of this may change, but the current structure is that a community member would reach out either through a consumer complaint form with the Attorney General's office, or they would reach out directly to the Attorney General's office. And that complaint would say, I believe that my local government spent money improperly on this specific item or activity. Then the Attorney General's office is responsible for doing an investigation. And that could result in a lawsuit for the county, but doesn't necessarily mean that that will be taking place. But that is a possibility. And so I think working with Corporation Counsel or the attorney that's been retained for opioid settlement purposes is really important before folks move into that spending phase, to make sure that both opioid remediation, that definition, and Exhibit E do align. And then, of course, to me, the most important part about spending these funds is understanding the spirit of these settlements. We've done a lot of work throughout history to work to incarcerate more folks, to work to penalize more folks around their substance use disorders. And we know that that work has not reduced the overdose deaths. And so in order to do that, these settlements really push towards a more public health approach, push towards a more person-centered approach. And what does that individual truly need, and how can the services funded support those most profoundly impacted? So I think keeping that the spirit of those settlements, and how do we help individuals with substance use disorder and co-occurring conditions is really the core of this work. So thank you guys for attending today. Thank you, Derek and Mac, for hosting. And please reach out with any questions that you may have.